Hey everyone, welcome to a deep dive all about the future of HIV treatment. We're going to be talking about how things are changing, and let me tell you, there's some really cool stuff happening.
It's exciting.
Yeah, I'm out with this article called HIV Treatment Advances, What's New in 2025. And it's packed with info on all the breakthroughs. It's amazing.
Yeah, it's really remarkable how much progress has been made. Back in the day, getting an HIV diagnosis, it felt almost like a life sentence, But
Yeah.
now, thanks to all the advancements in treatment, people with HIV, they can actually expect to live a totally normal lifespan.
That's exactly where I wanted to start. I mean, it's incredible. So let's go back in time for a sec, back to the 90s when everything changed. That's when we got antiretroviral therapy, RRT. Can you give us a quick breakdown? How does RT work? And why was it such a big deal?
Okay, so basically, RT is like a cocktail, right? It's a combination of medications. And these medications, what they do is they basically stop the HIV virus from replicating in the body.
Okay.
And when that happens, it keeps the virus suppressed. It gets so low that it becomes undetectable.
Undetectable, wow.
Yeah. And what that means is it can't be transmitted to others. It's like, imagine putting the brakes on the virus, It gives the immune system a chance to, recover and actually, function properly.
So RT is the kind of the foundation for everything,
Yeah,
right?
yeah.
The article talks about even more progress in 2025, making treatment even better, easier for people.
Yeah.
One of the coolest things I saw was this long-acting injectables.
I'll see.
No more daily pills, I'm in.
Oh, absolutely. Yeah, these injectables, they're game changers. One example is Cabenuva,
Okay.
and they're given once a month or even, get this, every other month.
Wow.
And studies show they work just as well as those daily pills in suppressing the virus.
So it's the same effectiveness, but way easier.
Yeah, it's a huge step forward, especially for people who, maybe struggle with remembering to take pills every day. It just simplifies things.
I bet it just gives people so much peace of mind too,
Yeah.
one less thing to have to think about all the time. But I was thinking, what about people who don't like needles? Are there
Right.
any other options for them?
You know what? There are. Chewable tablets, dissolvable ones too. They're getting more and more popular.
Wow.
A great alternative for people who have trouble with pills,
Mhm.
or maybe they want something more discreet.
That's so cool. So it's treatment's getting more personalized,
Right.
more flexible.
Right. Tailored to individual needs. And speaking of personalized care, this article talks about something called pharmacogenomics.
What?
Pharmacogenomics.
Okay.
Basically, it's a way of looking at how your genes affect how you respond to medication.
Okay.
So they analyze your genes, and they can predict what RT regimen is going to be most effective for you. And it also helps minimize the chance of side effects. It's like creating a custom treatment plan.
That is incredible. So it's not like a one-size-fits-all approach anymore.
Oh, not at all. We're moving into a world where HIV treatment is highly personalized. They take into account your genes, your lifestyle, your health history, everything. This approach is leading to much better outcomes.
It's like having a detective on your side, figuring out exactly how to fight the virus based on your personal blueprint. And to add to all that, the article even mentions AI and machine learning, analyzing data, recommending treatment strategies. It's like sci-fi stuff.
Yeah, AI is incredible. It can process huge amounts of data, identify patterns we might miss as humans. It helps doctors make better decisions. This combination of human expertise and AI is really powerful.
So we've gone from a scary diagnosis to personalized treatment plans based on your own genetic code. It's not just about living longer, it's about living better, having a real quality of life with HIV.
Exactly. It's about empowering people, letting them live their lives without being burdened by their condition. And that brings us to another important part of HIV care, managing those other infections and complications that can come along.
Yeah, because having HIV can increase your risk of other health problems, right?
Yeah.
Like the article mentions TB, hepatitis, even heart disease. It's like one thing leads to another. Are doctors getting better at dealing with these challenges?
Absolutely. They're really emphasizing integrated care now. They manage those co-infections proactively so they don't become serious. This holistic approach is key to making sure people living with HIV get the best care and stay healthy.
It's not just treating HIV in isolation, it's looking at the whole picture.
Right, and tailoring the treatment plans accordingly. It's much more proactive and holistic.
That's awesome. So it sounds like there's a lot of reason to be optimistic about HIV treatment, but what about a cure? Is that something scientists are actually working on?
They are. Cure research is, it's really hot right now. There's groundbreaking stuff happening all over the world in labs. But before we get into that, it's important to understand the challenges. This is not an easy thing.
So tell me, what are the hurdles? What's standing in the way of a cure?
Well, HIV is a tricky virus. It can hide, you know?
Right.
It lies dormant in reservoirs in the body, basically invisible to the immune system.
So it's like a master of disguise. Even if art suppresses it to undetectable levels, those hidden reservoirs could still reactivate if you stop treatment, right?
Exactly. And that's why suppressing the virus isn't enough for a cure. We need to eliminate it completely, get rid of those reservoirs, and that's where some of this cutting-edge research comes in.
Okay, I'm ready. Tell me, what are the most promising avenues for a cure?
There are a few really exciting areas. One is gene editing. It's like using techniques like CRISPR to change the genes of cells. Scientists are trying to use this to make cells resistant to HIV, or even to directly target and destroy the virus in infected cells.
Gene editing, that sounds like something out of a movie.
Yeah, it's pretty amazing, right? It has huge potential. Another exciting area is immunotherapy. That's where you boost the body's own immune system to fight the virus.
Oh.
Researchers are trying to train the immune system to recognize and destroy HIV-infected cells, more effectively. So you create this long-lasting immune response that can keep the virus under control.
So you give the immune system a superpower, basically.
Yeah, make it a better HIV hunter. And these approaches, while they're still early, they have immense potential for a cure. But we need to remember, it's a long road. It takes time to test these therapies, make sure they're safe, and that they work before we can use them widely.
It's not an overnight thing, but at least they're making progress. It's exciting. So while we wait for a cure, prevention is still really important, right? The article mentions some progress in that area too. Can you tell us more?
Yes. Prevention is huge in the fight against HIV. And there have been some big steps forward recently. One of the most effective things out there is pre-UP, pre-exposure prophylaxis.
Yeah, I've heard of pre-B. It's like a daily pill that can lower your risk of getting HIV, right?
Right. Pre-P stops the HIV virus from taking hold in your body. And now they have long-acting injectable pre-EP, like Cabenuva, but for prevention. You only need it every other month.
Wow, that's even easier than a daily pill. That must be a game changer for people who are at risk.
It is. And in addition to pre-P, there's PP, post-exposure prophylaxis. That's medication you can take after you've been exposed to HIV.
So if you think you might have been exposed, you can take PP to stop the virus.
Exactly. It's most effective within 72 hours of exposure, so it's super important to see a doctor right away if you think you might have been exposed.
It's like an emergency button you can press to reduce your risk.
Exactly. Both pre-P and PP are vital tools, but it all starts with knowing your status.
Right, getting tested.
Yes. And advancements in HIV testing have made it so much easier to do that. You can get rapid tests that give you results in like 20 minutes just from a finger prick. You can find these tests everywhere, clinics, community centers, even some pharmacies.
No more waiting weeks for results. That's amazing.
It really is. And knowing your status is so important for prevention and treatment. If you're negative, you can take steps to stay that way, like using condoms or taking pre-P. And if you're positive, you can start treatment right away, which is the best thing for your health and for preventing transmission.
It's all about being informed and empowered, right? The more we know about HIV, the better choices we can make for our health.
Couldn't agree more. Knowledge is power, especially when it comes to HIV.
This has been so informative. We've talked about the history of RT, personalized treatment, even cure research, and the latest in prevention and testing. It's amazing how far we've come. But there's one more thing I'm wondering about. How are doctors keeping track of their patients' progress? How do they know the treatment is working?
That's a great question. And it brings us to another area where technology is making a big difference, monitoring. But I think we should save that for the next part of our deep dive.
All right, you've got me hooked. When we come back, we'll dive into the world of HIV monitoring and see how technology is changing the game.
So right before the break, we were starting to talk about monitoring HIV and how technology is becoming more important.
Yeah, it feels like things are getting really personalized and data-driven.
You got it. One of the biggest advancements is in how we test viral load.
Okay.
These tests, they measure how much of the virus is actually in your blood.
Okay.
And they've become so much more accurate and much easier to get.
So it's like doctors can track how well the treatment is working almost instantly.
Pretty much. The goal is always to get that viral load down to undetectable levels.
Yeah.
It means there's so little virus it doesn't even show up on the tests.
I've heard that term undetectable, but what does that actually mean for someone who has HIV?
It's fantastic news. For one, it means the treatment is working exactly like it should.
Right.
But also, and this is the big one, it means they can't transmit the virus to anyone else.
Wow.
Yeah, it's huge. We call this UU, undetectable equals untransmittable.
That's a really powerful message.
It is. It takes away a lot of the fear and stigma that used to surround HIV. But even when someone's undetectable, regular monitoring is still important, just to make sure things stay that way.
Makes sense. You get stay on top of it. So how often do people need to get tested?
Well, it really depends. Every person is different, and their treatment plan might be different too.
Okay.
But usually, people with HIV get their viral load checked every few months.
That doesn't seem too bad.
No, it's manageable. But the article also hinted at some even cooler stuff on the horizon, like real-time monitoring.
Really?
Yeah. Imagine wearable devices that could track all sorts of things, maybe even viral load someday.
A smartwatch that tells you your viral load. That would be amazing.
Right. We're not quite there yet, but the possibilities are huge. This kind of real-time monitoring could help doctors change treatment plans much quicker, be more proactive, and get even better results for their patients.
So it's not just about taking your meds anymore. It's like this constant feedback loop between you and your doctor.
Exactly. Treatment becomes truly personalized and responsive.
It's mind-blowing how far we've come with HIV.
Right.
We've gone from a scary diagnosis to personalized treatment, managing other infections, talking about a cure, and now we have all this amazing technology for monitoring. It feels like HIV isn't a life sentence anymore. It's something you can manage.
You're absolutely right. And it's not just about the science, it's about how society sees HIV too.
Yeah.
There's much less stigma now, more understanding and acceptance, and that's so important for people living with HIV.
Yeah, it's about changing the whole narrative around HIV, moving away from fear and judgment and focusing on hope and empowerment. But even with all this progress, I'm sure there are still challenges, right?
Of course. Access to treatment is still a big problem in many parts of the world. And even though we're making progress with stigma, it still exists, and that can prevent people from getting tested or seeking treatment.
It's true. We still need more education and awareness, and we have to break down those barriers. But all in all, it seems like the future for HIV care is pretty bright. What would you say are the most important things for someone living with HIV today to focus on?
That's a really great question. I think it comes down to three things: knowledge, empowerment, and self-advocacy.
Yeah.
First, learn as much as you can about HIV, the treatments, the prevention options. The more you know, the better you can make decisions about your own health.
Knowledge is power.
Exactly. Second, take charge of your own health care. Talk to your doctor openly and honestly, ask questions, and speak up for what you need. You're your own best advocate.
Don't be afraid to be assertive, right?
Exactly. And the third one, self-advocacy. That means getting involved. Join a support group. Connect with other people who are living with HIV. Fight for policies that make care more accessible and reduce stigma. Use your voice to make a difference.
So it's about realizing you're not alone in this. There's strength in numbers.
Right. Living with HIV can be tough, but it doesn't have to define who you are. There are people who care, there's help available, and there's a lot of hope for the future. Don't be afraid to reach out, connect with others, and see what's possible.
That's such a powerful message. This deep dive into HIV treatment has been incredible. We've learned so much about the amazing advancements, but what really sticks with me is that message of hope, empowerment, and the importance of community.
Absolutely. It shows how strong people can be, both individually and when we come together. We've made such progress, even during a global pandemic, and the future is even more promising.
And for anyone listening who's living with HIV or knows someone who is, remember, you're not alone. There are resources, there are people who understand, and there's a whole community ready to support you. Reach out, ask for help, and embrace the journey.
Exactly. And never underestimate the power of your own voice to create positive change, for yourself and for everyone else.
This conversation has been so insightful and inspiring. But before we go, there's one more thing I wanted to touch on, something we don't always talk about with HIV. Mental and emotional well-being.
That's so important. HIV isn't just a physical thing, it affects you emotionally too, and we need to address that.
Right? We've talked about the physical impact and all the progress in treatment, but what about the emotional side? The stress, the stigma, the fear, the uncertainty, it all takes a toll on mental health.
Absolutely. And that's why it's crucial to include mental health care in HIV treatment plans. Things like counseling, support groups, stress management techniques, they can all help people cope with the emotional challenges.
So it's about treating the whole person, not just the virus.
Exactly. A holistic approach to care considers both physical and emotional needs and gives people the support they need to truly thrive.
This makes me wonder, how can healthcare providers create a more supportive and empathetic environment for people living with HIV?
It starts with listening, with empathy, and with creating a safe, non-judgmental space for people to talk about their concerns. Healthcare providers need to be sensitive to the unique challenges their patients are facing.
It's about building trust and rapport, understanding that each person's experience with HIV is unique.
Absolutely. We also need to address stigma directly and create a culture of acceptance and understanding within healthcare. That means educating staff about HIV, encouraging open communication, and treating all patients with dignity and respect.
Creating an environment where people feel valued, supported, and empowered to take charge of their health.
Exactly. When we prioritize both physical and mental well-being, we create a much more compassionate and holistic approach to care. That's what helps people truly live their best lives.
This conversation has been so insightful, shedding light on all the amazing progress in HIV treatment, while also reminding us how important mental and emotional well-being are. We've come a long way, but there's still work to do. We need to keep pushing for progress, both in terms of scientific breakthroughs and in creating a more compassionate and supportive environment for people living with HIV.
I couldn't agree more. The future of HIV care is bright, and together we can create a world where HIV is no longer a barrier to living a full and meaningful life.
Thank you for joining us for this deep dive into the world of HIV treatment in 2025. It's been a journey full of hope, inspiration, and a renewed sense of possibility. And if you're listening and you're living with HIV, or you know someone who is, remember, you are not alone. There are resources, people who care, and a bright future ahead. Don't be afraid to reach out, find your community, and embrace the journey.
Absolutely. And never underestimate how much power you have to create positive change for yourself and for others.
Until next time, stay curious, stay informed, and stay connected. You know, it's pretty amazing when you think about it, how far we've come in such a short amount of time.
It really is.
We've gone from a disease that, people were terrified of, they didn't understand it, to a condition that people can manage. And the future looks, full of hope. It's quite a journey.
It really shows you how resilient humans are, both individually and as a society.
Yeah.
The advancements we've talked about, the life-saving meds, the personalized treatments, the research going on for a cure, it all shows how dedicated we are to finding solutions and making lives better.
And for anyone listening who's been touched by HIV, whether personally or through someone they know, I really hope this deep dive has given them a sense of hope, that they feel empowered.
Absolutely. Knowledge is power. And I encourage everyone to stay up to date on all the new things happening with HIV prevention, treatment, care. There's so much good information out there. And connecting with organizations like Continental Hospitals, it can make a huge difference.
Speaking of Continental Hospitals, their website is amazing. So much information. If you're looking for expert advice, support, or just want to learn more about what we talked about today, definitely check it out.
I agree. It's a great resource. And as we wrap up this deep dive, I want to leave you with one last thought.
Okay.
The fight against HIV, it's not just about medicine, it's about society. We need to keep challenging the stigma around HIV, promoting understanding, and making sure everyone who needs care can get it.
So true. We all have a part to play in creating a world where HIV isn't something to be afraid of or ashamed of, but a condition that's managed with dignity and hope.
That's the future we're working towards, a future where everyone living with HIV can thrive. Not just survive, but truly thrive.
It's a beautiful thought. Thank you so much for joining us on this journey into the world of HIV treatment in 2025. It's been an amazing conversation filled with hope, inspiration, and a feeling that anything is possible.
It has been.
And for all of you out there listening, living with HIV, or who knows someone who is, remember, you are not alone. There are resources, people who care, and a future full of promise. Don't be afraid to reach out, connect with others, and embrace the journey.
So well said. And never forget the power you have to make things better, both for yourself and for others.
That's a great note to end on. Stay curious, stay informed, and stay connected, everyone. Until next time.